If you have been losing weight and you cannot explain why, and in a space of about 3 to 6 months, you have lost about 10 kilos, you should be suspicious. There can be a whole lot that can be causing your weight loss, but TB stands up there and you should be investigated for it. Did you know that in the year 2024, we diagnosed about 95,000 people with TB in Uganda alone? That means that each and every day of the year 2024, about 250 people were being infected by TB disease. TB is an infectious disease that is spread from one person to another through respiratory droplets. It is caused by a small mycobacterium called Mycobacterium tuberculosis. Now, as someone who has active TB disease, which is normally in the airway or in the lungs, can transmit this from one person to another. When this person coughs, when they talk, when they laugh, they release these droplets which contain a big number of bacteria into the air, and when you, the healthy person, breathe this in, they finally cause an infection. How do they cause this infection? When you breathe this in, they go down into your lungs, they settle down and form small pockets called tubercles. These small pockets can either progress to active TB disease or they can stay as latent TB disease. But about 90% of those who are actually exposed will generally stay with this latent TB disease for a long time. But there is this 10% of us that will definitely develop the active TB disease. And who are we talking about? These are normally our judges, the elderly people, our babies. These are normally the below 5s, and those whose immunity is generally compromised for one reason or another. Now, back then, it used to be considered that HIV was the biggest risk factor. It still stands up there, but then we have lots of other things that affect our immunity and predispose us to transitioning from latent TB disease to active TB disease. Some of the common things: one, if you have HIV disease, of course, and if you are a smoker, it means that your lungs are definitely going to be compromised and you are at a high risk of progressing from the latent TB disease to active TB disease. Those people who have chronic kidney disease and they are undergoing dialysis, they are still high up there in the risks. And then we also have people who are malnourished. These people who are malnourished, commonly we have the prisoners, of course we have children, of course we have the elderly, of course we have those people who are generally malnourished for one reason or another, including just alcoholism. We also have the new trend that is coming up, people with diabetes mellitus. These people also have a bit of a lowered immunity and they are also at risk of developing active TB disease. Now, TB does not only affect your lungs. TB can affect each and every part of your body. That means that TB will present with a whole lot of symptoms. Some of them, we consider them vague and they will need further assessment to actually determine and diagnose someone with TB. However, we have our 4 cardinal symptoms. First up the list, of course, we have cough. Normally we say that if you cough about 2 weeks or more, that is if you're a healthy individual, or if you're coughing and then you go to the hospital, the cough is treated, it is productive, it is not going away after being exposed to antibiotics, you should be in position to seek for help and be assessed for TB disease. The TB is actually caused by a bacterium. That means that sometimes you may expose them to certain antibiotics and you may see a bit of an improvement in your well-being. But if it has actually not cured, it is possible that that could be TB. Normally the cutoff is 2 weeks. However, for those people who are immune compromised, including of course our colleagues who are living with debilitating illnesses, you do not have to wait for 2 weeks to actually have a suspicion of TB. The second cardinal symptom is weight loss. If you have been losing weight and you cannot explain why, and in a space of about 3 to 6 months, you have lost about 10 kilos, you should be suspicious. There can be a whole lot that can be causing your weight loss, but TB stands up there and you should be investigated for it. The third symptom is night sweats. If you are sweating at night, we call them drenching night sweats. By drenching night sweats, you go to sleep and your bedding seems like they poured water on you, but you cannot explain why you are sweating a lot at night. You have to be investigated for TB. And then finally, the fourth cardinal symptom is unexplained fevers. You are there, you are just feeling hot. They commonly occur in the evenings and they do not go away over an extended period of time. You should therefore be investigated for TB. We also have a few other symptoms, and these are commonly in the children. If your child is generally chronically sick, you should be investigated for TB. If your child has poor appetite, they should be investigated for TB. If your child is not gaining weight as they should, your child has hit the 6 months mark, but the child is not exactly gaining weight as per the expected curve, which is normally all over the hospital when you actually go to the children's clinic, your child should be assessed for TB. We have a few new changes. Sometimes you may just go to hospital and do a chest x-ray, and they may find something that points towards TB. You should also be investigated for TB. But for you back home, those are the cardinal symptoms that you should look out for. And once you find this, you should be in position to go to a health worker who should then be able to initiate the process through which TB is investigated, diagnosed, and subsequently treated. So what exactly happens when you see yourself with these symptoms that we had talked about previously? Of course, go to your healthcare provider and then get screened for TB. What are the common things that we do when you're screening you for TB? If you do have a cough, we can always get that sputum and we can be able to examine that sputum and come up with a diagnosis. Many of the investigations that we do for the TB are things that come out in a few hours, and normally by the end of the day, we do have a diagnosis and we start you on treatment. Now, when you start treatment, it is very, very important that you adhere to the treatment that you have been started. Because earlier on I said that many people progress to actually pass on, and this is for many reasons. One of those is that sometimes we do not adhere to treatment, and when we do not adhere to treatment, we normally push the TB towards antimicrobial resistance, and if you are not well followed up, we may not be able to pick that up in time, and it may end up being fatal. You may end up passing on from this particular disease. So indeed, when you see these symptoms, come in, visit your healthcare provider, let us do the necessary investigations, diagnose TB, and let us start treatment for TB, and let us complete the treatment so that you can go back to your day-to-day life. It is important that you come in early. The earlier you come in, the easier it is to treat, because you come in when your body is still a little bit healthier, and it will be in position to actually fight this illness, as some of the complications may not have set in, and even then, at the end of the treatment, you will still be in position to go back to your work. When you come in a little bit later, you may have a few complications that may have damaged some of your organs irreversibly. That means that at the end of the treatment, you'll probably need to take a little bit more time to undergo rehabilitation and eventually get back to your baseline. Let us investigate you, let us start you on treatment, and then let us progress towards your previous lifestyle. Now, there is a lot of good news. We have made quite significant changes, both investigating for TB as well as managing TB. We have come up with lots of new investigations. Some of these are able to isolate the particular bugs that are there. Some of these are able to detect if you are resistant to particular antibiotics, and that means that we can be able to adjust the treatment in real time. And some of the new advancements is that we also have some AI that we are incorporating, in that sometimes you may not even see the doctor, you may not see your healthcare provider, but the moment you go in and do some of these things like a chest x-ray, some things can be picked up from that particular x-ray, and we can be able to have a high index of suspicion to say that you have TB. So please definitely come in and let us investigate you. There is also a lot of good news in regards to treatment. We used to have injectable formulations. Now we actually have oral formulations, and these oral formulations actually last a bit of a shorter time, and they should be in position to generally cure you faster, even when it is drug-resistant TB. We have a whole lot of new development when it comes to children. It is really hard to investigate TB among children, because remember, children cannot normally cough out their sputum. We have been able to formulate ways of actually picking up that sample out of their stool, which is not invasive. Kids normally poop on a day-to-day, so it's a bit easier for us to actually do that. We're able to pick up those with the degree of accuracy and be able to diagnose the children. Also, we have some new formulations in regards to treating children. These formulations normally take a shorter time, which means that the other toxic effects, the other adverse effects that are associated with the treatment of TB is a little bit safer for the children now, because they do have a shorter regimen. So do not exactly hide out there. When you see these signs, come into the hospital and let us investigate you, let us initiate you on treatment, and let us cure you in real time.